As of this week, the academic arena here in Korea is open, and for now, the decision, or the right that is, to decide on the method of learning has been granted to school authorities. For more, I have Professor Kim Moon-kyu from Yonsei University. Professor Kim, it's good to have you with us.
Great to be here again, Sunny.
I also have Professor Choi Young-jun at Korea University live on the line. It's been a while, Professor Choi. Welcome back.
Thank you for having me here.
Right, Professor Kim, those aged 18 and below, that is, or below 18, I would say, account for at least 24% of all infections here in the country, while those aged 60 and above who have been boosted account at most for 10% of all infections. I suppose this particular finding itself reflects the importance of inoculation.
Yeah, the original Wuhan strain was relatively infecting the aged group, sparing the children. And it's not for the Omicron, and as you know, there are many mutations in the S protein, and I think that's one of the reasons that more children get infected. But also, the vaccination clearly played a role preventing infection, especially severe infections. And as most of the children are not vaccinated yet, that will be the reason why, one of the reasons why more children are getting infected. But I already mentioned many times that more and more time goes by, we should be focused on the severe cases, not the total number of cases. And booster shot issue is still not determined yet for the children, so it's very hard to say what we're going to do with the children not vaccinated or vaccinated twice. So that's the reason I'm waiting for a clinical study with Novavax, which might be have less side effects for children, and also for the long-term effects is not clear.
Right. Professor Cho, what, meanwhile, is your outlook with regard to infections among the young here in Korea as we slowly but steadily head toward our own Omicron peak?
So, as in many parts of the world, we are experiencing more and more of the COVID cases in children. And it's also happening in Korea as well here. And there may be a couple of reasons why. First, because the adults are now vaccinated and are being boosted against the COVID. And the virus will probably look for the places where they can find the infection, which is the children who are not vaccinated. Another part is that the children are by nature very susceptible to the respiratory virus infections compared to the adults, including non-COVID coronaviruses that can cause the common colds or respiratory infections. So I think there is a good explanation why COVID is increasing in children and why it could furthermore increase in the kids in the coming months.
Right, so essentially speaking, Professor Che, you do expect a further increase in infections among children as we have started our academic year?
Correct.
Right. And Professor Kim, starting this month now, regardless of vaccination status, a person residing with a COVID-19 patient and who has tested negative, of course, is not required to quarantine. How does this ease in prevention measure look to affect public or pandemic safety within school grounds?
Well, if you do not quarantine a person who is exposed to confirmed cases, that kind of policy will increase the cases. But it does not mean that it's going to be a dangerous situation in schools. It's dangerous for only risk group, especially in children. We worry about severe obesity, diabetes, congenital heart disease, chronic lung disease, and epilepsy. And one more thing, we have feeding tube dependency. And most of these patients do not go to school, so that's something good. Children may be asymptomatic or even have a mild common cold or mild intestinal flu. So I think there's no need for testing family members if the symptoms are mild or negligible. Under current policies, it is inevitable that all the students are going to be gradually exposed to Omicron, just as Professor Kim in Hong Kong mentioned. And I'm worried that there was a big confusion in the school managers, for the school managers, because they have to decide for themselves about what they're going to do with students happening or not. But anyway, we have to keep on the basic rules, wearing masks and hand hygiene, distancing, disinfecting the facilities if needed, with students attending schools.
Right. And Professor Che, how do the potential risks of in-person learning amid Omicron, that is, compare to such learning efforts during our earlier waves of COVID-19?
So, yes, you're right, Sunny, that I think the Omicron is obviously very different from the original strain that was isolated from Wuhan or even the Delta strain. So we are facing a very different virus. So I think children who go to elementary schools have not been given the chance to vaccinate as of now, and given that more and more cases are growing in this population, I think it is reasonable to say that there will be more cases when the kids go to schools. But when we look back how we handled the schools over the past 2 years, kids were not allowed to go to school in many parts of the world, including Korea. They had not had the right to be educated or play with their friends, get socialized, or being taken care of by when they are needed. So if we compare the numbers, the risk of getting really sick because of the Omicron COVID versus not going to the schools, getting the unequal the chances of learning, I think not going to school causes much higher burden than having a chance of getting COVID, as Professor Kim from Hong Kong University have mentioned. So I think the vaccine will be a good available option really soon and can provide a good protection to children in that sense.
Right. And Professor Kim, what, meanwhile, are your thoughts on current government efforts here aimed at treating children with COVID-19?
Well, they recently informed that there is going to be about 26 clinics or hospitals responsible for COVID-19 cases. It's very encouraging that we do have it, but so the size of our population is huge, so we need more than that. Actually, I tried to find the information about those 26 centers, but it was very hard. I don't know how to get it. Maybe you may have to contact 119 or something to get those informations. Already, most of the clinics or emergency departments are very busy getting phone calls from the parents whose children is sick due to Omicron, and there's a huge limitation in communication by phone, especially if the children cannot speak and express how they feel. So it's very dependent on the caregiver's insight. So recently we started to use a phone plus webcam before we start the face-to-face physical exam on emergency department to triage, to decide whether this patient is urgent or not. I think we need some kind of similar methods for those 26 clinics. That might be helpful.
Right. Which is probably why, Professor Che, health authorities here are actually working, that is, to ensure in-person COVID-19 treatment for children instead of opting for the remote option. Could you further explain these efforts for us?
Correct. So as a pediatricians, we are seeing the kids ranging from little babies to huge teenagers, saying by the size of the body. And as in most age groups, our patients cannot usually express their distress or symptoms that can be easily seen by their parents or untrained persons. So as the clinicians we are here, and it is very important to watch a child very carefully, ask the parents how they are doing, and examine the kids with our eyes, our ears, and hands to find out how we can help these kids. So I think it is quite important that in many cases, in-person medical treatment is very important. But as Professor Kim has mentioned, I think if it is not feasible in some cases, still non-in-person medical treatment can be also an option here, I think.
Right. Moving forward, Professor Kim, and back to the idea of vaccinations, of course, Korea has recently granted the green light for vaccines for children aged 5 to 11. Having said that, what can you tell us about the efficacy of COVID-19 vaccines for this particular age group?
Well, until now, only Pfizer is authorized to use in 5 to 11 years age group, and they're using only 1/3 of the dose of adults, which means only 10 micrograms. There's only a small number in this study, and it's all preliminary data that, but it says that about 90% effectiveness, but it's getting weaker by time, so we don't know whether this dose is enough. If we increase the dose, we have to worry about the side effects and still unknown long-term effects. If we want to maintain this, we might have to do something more, giving second shot, booster, and whatever. And we don't know why this kind of phenomenon is happening. And there's one more issue currently published in a medical journal. And there was some autoimmune hepatitis after Pfizer vaccination, and the scholars look into this, why this kind of thing happens, and they realized that if you have a Pfizer shot, the lipid nanoparticle is in your injection site, and the second site is the liver. And they realized that those particles go into the liver cells, and some of them actually change the DNA expression, and we don't know what's going to mean. It's only just the preliminary data. So I just want to say that the Pfizer vaccine we are using right now, we are not sure about the long-term effects. Let's say for adults, you may worry about 10, 20, or 30 years, but if you give it to children, you have to think about 50 years, 60 years, or even longer. So we have to be very cautious giving this kind of new vaccines, especially in a short period of time.
Right, and staying with the concerns raised by Professor Kim, Professor Che, based on studies overseas, what more can you tell us about the vaccination side effects among children?
So I can't agree more with Professor Kim that we should be very cautious to the children's safety in terms of the vaccines, because thinking about the vulnerability of this population and how long they're going to live compared to us. And also they can't choose to get vaccinated or not, just unlike us. But from the clinical data and the scientific perspective view, the vaccines are very safe to the kids at this point that we are seeing from the data that was shown in the clinical trials. That shows very few mild symptoms, including about 30 to 40% getting tired, small chills in small portion of people who got the vaccines. And these symptoms do not usually last long, usually disappear within like 3 or 4 days. From the field trial that we can detect more of the serious but rare adverse events. They have been seen in a few cases, but usually didn't cause big trouble, and also was very few compared to other age groups. So I think at this moment, at least we can say that the vaccines in short term are safe to the kids.
Right, and staying with that, Professor Che, what are your thoughts on booster shots for teenagers?
I think the government has not yet decided to give the booster shot at this moment, but they are discussing actively now. I think they might do that because there have been seen the effectiveness of vaccines do wane over time without the booster, and will provide a better protection, even especially in the current the variant of the Omicron that have been dominating since the January of this year. So I think it might provide a better protection if the child has received the vaccine for more than 3 to 6 months.
Right. And Professor Kim, moving forward then, what would be your words of advice to share with those who are taking care of children infected with COVID-19 at home?
Well, I wish that government may give more clear indications whether you're going to have the test or not. My personal opinion, if the symptom is very mild or tricky, I mean, you don't know whether I having a symptom or not, I don't recommend to go on testing. So anyway, if you have fever, sore throat, coughing, and abdominal pain or something else, then you better start quarantine yourself or your children. For the caregiver has to wear mask, the children has to wear mask. They should stay in a separate room, and all the cups, dishes, and towels should be separated. And whenever possible, you should keep a 1 meter distance from the children. And only one keeper should be responsible for the children who is getting infected. Open your windows as much as you can for ventilation, and you better stay home. You know, all the words that I'm mentioning is about the general rules. I mean, not only for the Omicron. If you get a fever with some kind of flu, we should follow this kind of procedures. So keep these rules, keep hydrated, and you should know the phone numbers you have to call for those 26 hospitals, the centers you may have to contact. And if you have underlying conditions that I previously mentioned, you better contact the hospital you are attending or visit the emergency department.
Right. And Professor Che, what would be your words of advice to school children who are required to attend school but are living with perhaps a confirmed patient at home?
I think for the school children who do have any confirmed patient at home but have to go to school, can still have to go to school because it provides much better benefit, which outweighs the cost of not going to the school. When we consider the severity of the Omicron variant and the cost that we have to pay for that. But for the safety measures, I think still what Professor Kim has mentioned all applies to the school children who go to the school. They have to keep their the personal hygiene, including hand washing. Of course, the mask is still the new normal that we have here, and the classrooms have to keep the fresh air with the good adequate ventilations. And also with a good disinfectant, the cleaned surface of the desk and the surfaces of the atmospheres. So all those the criterions and all this the guidelines that we have to follow still applies within at least for the next few months.
Right, they do. All right, Professor Che, thank you very much for your time and your thoughts. Professor Kim here in the studio, thank you for your insight today.
Thank you very much.